Anybody work with anybody with lymphedema? It's pretty interesting. I remember the first time I got a referral for it, it was a friend of a current patient, and I had to do a lot of studying before I felt comfortable treating her. It's totally different than just about everything that we do in therapy. So, what is lymphatic dysfunction? Overload of the system resulting in edema, impaired wound healing. So there's some gruesome pictures. Let me get one of those. These aren't even the bad ones. But this is not all. It's not all far off of what you would see. You'll see these pitting edema, lots of inflammation here. This one here, this is that brawny stuff. Ooh, that's brutal. And then you can have it so bad that it starts to weep as well. So all of those are problematic, as you can imagine. The origination of this type of thing through primary sources of heredity, which is pretty rare. More times than not, I think Kale will tell you guys this fall, 90% of the cases that she sees are after cancer treatment. It's radiation that kills off the lymph nodes, or actually physically remove the lymph nodes, and therefore they have trouble circulating the lymph that is needed. It can be combined with venous insufficiency. My father-in-law has this. He's supposed to wear like these stockings that compress and move the fluid and all that. He hates wearing them because they're hot. You can imagine how hot it would be to wear that type of thing. But it doesn't go away. This is something that we have to manage. It's not something that can be cured. Once you have this, you have this. Okay? Now it will ebb and flow, but it's not going away. You're not curing anything here. And you can imagine how when you get fluid accumulation to this degree, how it can damage other tissues too, with the swelling and so forth. You think that's a pretty stiff joint here? Heck yeah, they can't even move it most likely. Okay. You will see it majority on the dorsum of the hand and the foot. Centrally, in the areas of the lymphatic system where it gets clogged, in the axilla, the groin. This is pitting, and you will classify this by you make a thumbprint, how long it takes for the fluid to return to shape. That's how you classify it. This is brawny edema. Pressure is very hard, fibrotic changes occurring here. You can imagine what skin looks like. Even if you get rid of this fluid, the skin is going to be so stretched out and so damaged that you're going to have flaky skin, you're going to have stuff that peels all the time. It's just really problematic. And then again, this weeping edema is the most severe. They're greatly compromised with the wound healing. It's obviously an infection-driven type of thing here too. So obviously you can see the limb size here. Paresthesias due to the pressure of the fluid. Lots of stiffness we talked about, and the delayed wound healing, of course, down here. So not something that's fun. Now, management of this. A lot of times these folks go for manual lymphatic drainage. These are done by people who are certified to do this. I'm not certified. I would never try to do this with somebody. Although it's not hard, it's just something that you have to learn how to do. But the strokes are very light. So lymph sits right underneath the skin. Okay, it's not a deep pressure at all. It is a very, very light pressure. You're going to make circular motion, and you're going to work from proximal. You got to clear these areas, the groin, the axilla first, so it allows the fluid to move. Okay.
Is there any kind of pain?
Not a ton, I don't think. I mean, some of them that are really swollen, it's really uncomfortable, but I don't think there's a lot of pain involved. Not a population I've done a whole lot with. But you've got to clear these proximal areas to allow the pathway to go, okay? And the strokes will always be from distal to proximal. We don't ever want to move fluid this way, okay? We want to move it this way. So a lot of times when you're working with this population, you may have to position them in a certain way. High-low tables are great, pillows, get some elevation, things above their heart, all that type of thing. Now, once you do this manual lymphatic drainage, and again, sometimes these people spend an hour to an hour and a half at therapy. You work on them, and then they do this low stretch bandage. This is not ACE wrap, people. This is very light gauze type bandage, okay? It's not highly compressive at all. It's just a light wrap over the top that gives just a little bit of compression. And again, you're gonna work from distal to proximal. It's not like ACE where you're gonna squeeze it and push it out. It's just a light wrap, okay? Now, if they have something, excuse me, you guys have talked about pneumatic pumps, right? In modalities. There are things that they can put on them, and they come in for treatment and they stay there for like 15 minutes and do that for one extremity if it's just one case. But I think more for the most part, you're going to see more of this low stretch stuff. Again, the compression garments are usually going to be custom fit. Yeah, and they hate wearing these things. They're hard to get on and off, very hot, uncomfortable. You gotta watch their skin. Obviously, when you see this great bit of swelling, the skin is gonna stretch out, become very dry, brittle. We've gotta work through that, make sure skin is okay. And again, we wanna make sure that they can move through active ranges that are sufficient. These things tend to get very, very stiff. So having them do some light activity is certainly gonna be advisable in a therapy session. These types of exercises, okay? They're gonna have the compression garment on. Start with deep breathing relaxation, which we'll talk about here in a few minutes. And these are really pretty easy exercises. You know, things like arm circles and scapular mobility exercises, pelvic tilts, curl ups, things like that that are really simple. But again, you're gonna work proximal to distal. So you might have them do some wrist stuff. Move to the elbow, okay? Just start here and move this way. Relaxation with the extremities elevated. Again, you can if they've got a bunch of edema, lymphedema in one leg in particular, or both, you can have them sit with their legs elevated, have them doing ankle pumps and things like that. They'll love that, they're fine with that. All right, I want you to just think about this. Again, there's a bunch of exercises in your book, 975 to 975 to 979. Think about this first case. Mastectomy with axillary lymph node dissection, stage 1 lymphedema in her right upper extremity. Basic exercise program, 3 exercises for lymphedema clearance. What's something we would want to start with her, exercise-wise? Love it. Just very, very simple. Just having them grip something. It doesn't have to be something hard. They could just do that. Gripping a sponge, washcloth, something like that. What else could we do? Arm bike might be a little bit of aggressive, but let's start again. Let's stay here and work our way up to maybe elbow. So we just got flexion and extension, and we got supination and pronation. Just really simple, basic things, okay? And again, you might want to think about them doing this in a supine position where we're getting gravity influence in as well, okay? Justice just showed arm circles. That's a good one as well, okay? Then we might think about UBE as they get a little stronger and used to just doing this type of thing, okay? But again, thinking proximal to distal and being careful of the intensity. Case 2, hysterectomy, followed by radiation. Pretty common, okay? Bilateral lower extremities, stage 1, basic exercise program. Ankle pumps is tremendous. What else? Doing things with their toes can be helpful. Yep. Towel pickups, pick up marbles, things like that. Then you can have them start doing some ankle pumps, ankle circles, maybe even depending on the severity of it. Great, the stage 1, they could probably do some heel and toe raises. Then you start thinking about working up to the knee, maybe even some little baby squats, just range of motion. Again, you've got to be able to prescribe exercises appropriately, okay? All right, let's take a 10-minute break, come back to 5 till, and we will do relaxation and then obstetrics, and then we'll have our case.